This is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And I'm happy to introduce you to Dr. Maria De Santis, who is the director of the genitourinary program at the Kaiser Franz Joseph Hospital here in Vienna, and chair of the ESMO GU Non-Prostate Task Force. Welcome to the Group Room program.
Well, thank you for the kind invitation. I'm happy to be here.
Young adults present unique challenges. What are some of those challenges that you deal with as a practitioner dealing with this young adult age group?
Well, this is very much true. It is a challenge. And it is a challenge because these patients, these young men, are in the middle of their life, their working life. They are building up their families at the time point when this disease, this cancer occurs. So they are in a very special situation in their life. And this is one of the challenges because they have a risk of losing their job with being months of treatment, months of their work on chemotherapy. And there is also sometimes a problem with the support of their families. It is a really big burden for the patients and their families to go through all this. Yes, and in addition, it is on the one hand a highly curable disease, but on the other hand, those cured patients are at risk to experience and to have long-term side effects from their treatment. And this, I think, is a very important part of research also, to discover those long-term side effects and to try to make them or to have them become as minimal as possible.
Do you think you can reference some of what those long-term effects might be?
Well, long-term effects concern the nerves. Polyneuropathy is one of those long-term effects. Then cardiovascular diseases after cisplatin combination chemotherapy is a very important topic. The increase of body mass index and all the following potential risks for diabetes, for hyperlipidemia, etc. This is a problem, and there are many more.
Are provisions taken easily in Europe to help young men bank their sperm before they begin treatment?
Well, at least in my country, it is standard to inform the patient that sperm banking is possible, that we recommend it in certain situations. And many of those patients actually consider sperm banking. And it is especially important for those patients where we expect more than 3 to 4 courses of cisplatin-containing chemotherapy, the intermediate and poor-risk patients, for example.
Thank you, Dr. Maria De Santis, Director of the Genitourinary Program at the Kaiser Franz Joseph Hospital here in Vienna, and Chair of the ESMO GU Non-Prostate Task Force.
Thank you for the kind invitation.